Health Connections, and tonight we head to the Grand Island Foot Clinic for a visit concerning some runner afflictions. All right, welcome to another edition of Health Connections. We're here at the Grand Island Foot Clinic. I'm joined now by Dr. Blackburn. Thanks for being with us.
Thank you for having me.
All right, and it's really kind of running season right now.
Right.
We can run through some leg pain, hip pain maybe, but if you have a bad foot, that's a bad wheel, right?
Right, it's very difficult to work through that type of pain. Very common though when you're just getting started doing your running.
It really is. Plantar fasciitis is something a lot of runners deal with, and what exactly is that, Doc?
There's a connection of a small ligament type structure on the bottom of the foot that gets inflamed and overstretched and overworked when you're running, particularly with repetitive motions like prolonged running. Yeah. And it becomes very painful.
And it can be chronic as well, too.
Right. Most people try to run through it and they aren't able to shake that off, so it becomes something that they put off for months, and it is very affecting. It affects their running and their work life.
Yeah. Okay, let's talk about treatments available. Dr. Blackburn, if I'm dealing with this, how could you help me out?
Right. Oftentimes there's some stretching, some icing, some at-home type of care. Oftentimes for runners it's very important to change the insert in their shoes. There's also some other therapies that we can dig into if it becomes more of a troublesome thing.
If I go out for a jog, I'm worried about stretching my legs, that sort of thing. Can I stretch my feet? Is that what do you do with that?
The Achilles tendon and the plantar fascia are very closely interconnected, so stretching the Achilles tendon before a run is very important because it is also involves the plantar fascia for that too.
That Achilles tendon, boy, you look at a basketball player, and there's a lot of basketball injuries, runners as well, right?
Right. That tendon does a lot of work as we move around. It is responsible for lifting us up off the heel up off the ground, and if it gets inflamed or irritated, it can be very disabling.
Okay, other problems for runners out there as far as foot issues, Doc?
Stress fractures for people that push it too hard, too fast. They get cracks in those bones, and it's something that can stop you in your tracks.
Yeah, okay, you want to get in right away probably to the doctor as soon as you have some pain. I would think you don't want that to continue to get inflamed, right?
Yeah, like you're saying, if you try to run through it, a lot of times it's not very successful, and it's something that is repetitive as running. It's very important to make sure everything's in good working order.
Make sure the tires are up and running for sure. Doc, thanks so much. That's Health Connections for this week. Your tire up and running here?
Well, the
There
tire's
we go.
fine and dandy, but the ankle bone, well, the ankle bone is just bruised. Tore a ligament, strained a ligament, bone bruising.
How long you do in that boot?
Don't know.
Don't
Got
know.
a physical therapy appointment tomorrow, and we'll get more information from there.
Dave's milking it as long as he can. We'll be right back.